Welcome back to Morning Express. We're glad you're watching. It is now 8:33 a.m. In the next 20 minutes, we'll be talking about hepatitis in your health segment. And joining me in studio today is Eric Kitangala, who's a technical officer with the Regional Society for Blood Transfusion Kenya, or if you like, RSBTK. Also with us in the middle is Dr. Edna Kamau, consultant physician, and this is a very hard word, I hope I get it, gastroenterologist. Something of the sort. He'll tell us more about what that means. Also, Dr. Paris Njiri, officer RSBTK, or a member of the same organization. I'll start with you, Dr. Kamau. What is that gastroenterologist?
Okay,
what does that mean?
Okay, sorry, it is gastroenterologist.
Enterologist. Okay.
Gastroenterologist. It's subspecialty of internal medicine that deals with diseases of the digestive system and the liver.
Wow.
Yes.
Why do they have such a difficult word?
Exactly.
Anyway, let's get to our subject, hepatitis. Talk to us about what this is.
Okay, hepatitis basically refers to inflammation of the liver. In a layman's language, this would be basically swelling of the liver, and this would present with increase in size, with redness, and loss of function. And basically, viral hepatitis can be due to different reasons. The most common causes are viral hepatitis, but you also have other causes. We have alcohol being an important cause. We have toxins. We have drugs. And but the most important is viral hepatitis.
What do you mean when you talk about viral hepatitis?
Okay, viral hepatitis are infectious virus organisms, which are viruses that cause which infect the liver in addition to other parts of the body. And there are 5 main kinds of viral hepatitis. That's from A, B, C, D, and E. The most important in terms of public health is hepatitis B and C, because they're the ones which have the capability of causing chronic liver diseases. Hepatitis A has the potential of causing epidemic diseases, so it has a public health importance, but the most important that cause chronic liver diseases is hepatitis B and C.
Okay.
Yes.
So you've mentioned alcohol as one of causes. What else? Are you talking about, what is it? Of course, excessive intake and
excessive intake.
Yeah.
Excessive intake. We have drugs, predominantly some of the, like paracetamol, acetaminophen. We have a lot of toxins that can cause inflammation of the liver. But the most important thing is viral hepatitis.
Okay.
Yes.
Let's go to Dr. Njiri in terms of then what it manifests as, or how this hepatitis presents itself as.
Manifestations of hepatitis are varied. It can be either acute or chronic, depending on what is causing it. In the acute phase, it's usually like a flu-like symptom. You'll probably not know you're having hepatitis because patients will present with fatigue, fever, abdominal discomfort, and non-specific signs and symptoms here and there. But then that can proceed into acute kidney liver hepatitis, where you have the patient now presenting with jaundice, that is yellowness of the eyes, and in the long run can actually lead to cancer of the liver, which is now rising up in our setup.
Okay. So what are some of those what will we see with a person who has hepatitis?
So in the initial days, they'll just come presenting with non-specific symptoms.
So a lot of the coughs you've mentioned.
Cough, fever, tiredness. Okay. They can't do what they are usually used to doing, such non-constitutional signs.
All right.
But then one thing that you'll notice that they might have jaundice. The eyes will start being yellow. Now that will tell you they could be having a problem with the liver. Then sometimes they have now signs of liver failure. You can have a patient having swelling of the legs, swelling of the abdomen. Then now that can proceed into liver cancer, which we are now seeing in our setup.
Which is deadly. And when they go to hospital at these early stages of manifestation, is it easy for the doctors to catch?
Yes, it is easy because there are some various tests that we can do, which we are going to talk about.
All right.
They can actually be done from our labs in very many hospitals.
Talk to us about that, Eric.
Yeah, now for us, what we do at the Regional Society for Blood Transfusion is to make sure that we support in testing. We support the government, we support also the National Blood Transfusion Services to make sure that all the blood is tested so that by the time it is being transfused to the patient, because blood transfusion is one of the main avenues of infecting a patient, because once you give blood that is infected to a patient, of course that's a bolus dose, and immediately the patient will get infected. So what we do, we make sure that we work with the government to make sure that policies are put in place. Currently, the government policy is to make sure that blood is screened for hepatitis B and hepatitis C. you know, which are the most dangerous hepatitis. Yeah, so blood is screened and then, you know, be able to be transfused to the patient. And the other thing that we are doing is that we make sure that even all the donors, the people who are donating blood, are screened even before they donate the unit of blood to make sure that even by the time you're donating, you don't have signs and symptoms of hepatitis. So that is the kind of support we are giving the National Blood Transfusion Services and the government, just to make sure that blood is safe before it is transfused to the patient.
Okay. Who's at risk? Are we talking about hepatitis? What age group?
The risks varies depending on the hepatitis.
Okay.
For hepatitis B, maybe I should go back to the way it's transmitted. Hepatitis B transmission really varies depending on the area, the risk, the prevalence of the disease in the area. In high prevalence areas like in developing countries and Kenya specifically, transmission is predominantly perinatal and vertical. Vertical meaning from a mother to a child, perinatal meaning when the child is small, and usually transmission will occur when the child is less than 5 years. So usually the children who are less than 5 years at highest risk of getting hepatitis B.
Okay.
But other patients people who are at risk of hepatitis B are people who get regular blood transfusions, people who work with blood, either lab people or just healthcare workers, people who inject drugs, people who are chronic hemodialysis, people in constant contact with blood. Now hepatitis C, on the other hand, the transmission is much later in life, and usually transmission will be through percutaneous, and that will be through blood products. And so transmission will occur in people who get blood products and blood itself. So these would be people maybe who have chronic hematological blood problems, like sickle cell disease patients, hemophilic patients, people on hemodialysis, so that people who will be at risk. Hepatitis A, the general population is at risk if you do not have proper sanitation, because transmission is fecal-oral.
Okay, so it varies in terms of who can get it.
Exactly.
Is it a deadly disease?
It is.
Can it
It is. Yes, it is. It is.
Okay.
It's quite fatal.
Yeah. How so? What kind of scenarios are you looking at in terms of that level?
Like globally, what we are looking at is, you can imagine almost 700,000 deaths per year globally. And those are global statistics. So locally, you know, everybody will be like the issues of cancers, you know. People go to the hospital nowadays, you know, have liver cancer and all this. You'll find most of the time it's just due to hepatitis. And the figures which we are looking at, like in blood donors, around 1.8% of blood donors, you know, the people who donate blood, they'll be tested and it's going to be positive. And remember, this one is a highly, you know, skewed population, because they've undergone, you know, an interview just to make sure that they don't have it. But still we get like 1.8. And then if you're looking at, again, another global statistic of 2 million infections, you know, globally. So it's a disease that it's a hidden giant that it's really killing, and people don't know about it.
How is it a hidden giant? How is it that those so many lives have been claimed and we're not having enough attention to the disease, would you say?
I think it's because of the subtle presentation.
Okay.
Out of the many people who get infected, let me talk about hepatitis B specifically. Out of the like 100 people getting infected with hepatitis B, if they're young, majority of them will not present with symptoms when they're young, so they'll not be detected to have the disease. What they will get is a chronic form of it, and so their symptoms will come 20 years down the line, and when they will present with signs of chronic liver disease. So at that point, people will not be able, when they're getting infected, people will not be able to recognize that they have an infection. It's only way down when it's a late presentation, when they're having chronic liver disease, when they're starting to have their body swelling, when their eyes are swollen, when they're bleeding. That is when they'll be detected. So that is why it's a silent killer, because they only present when it's at the late end of the disease.
Okay.
And that is the same case with hepatitis C. Hepatitis A can present with a fulminant form, with a severe form earlier on, but that will be in high-risk population, like in the elderly population. But in most cases, viral hepatitis is very silent until later on when there are complications.
All right, talk to us as well about curing, because I'm hearing this is dangerous, it is killing people. So is there a cure? Do we know about treatment as well?
Actually, the best approach to it is actually prevention. Right now in our setup, all mothers, when they're expectant, they have an antenatal profile done to them. And part of the antenatal profile is having hepatitis B checked. So if they're found to be hepatitis B positive and infective during delivery, the baby is actually given an immunoglobulin which will prevent them from getting the hepatitis B. And as well, they are given a hepatitis B vaccine. In our immunization schedule for children now, the KEPI schedule, we have a pentavalent vaccine given at 6 weeks, 10 weeks, and 14 weeks. And part of the pentavalent vaccines is the hepatitis B vaccine. So actually that is the approach we are taking to preventing hepatitis B in children and infants.
Okay.
Yes.
So that's the prevention part. Let's go back to the cure.
That's for infants, yes.
That's for so the prevention being the most important varies depending on the age. So for the children, then it's what she's talking about. But for adults, as we say, the risk factors are different.
Yeah.
So in elder people, if they're injecting drugs, they're the people you don't want to give needles. You want to test them and treat them. If it's a person who has multiple sexual partners, you want to encourage them to get tested, to use condoms. If it's blood, you want to have it screened. If it is, so basically the risk factors will the prevention will depend on what's the most common cause of transmission.
Okay.
Yes.
What about cure? I've not had anything on cure. Is there no cure? I do not know how you can manage this.
There is cure. Let me talk about hepatitis B. It can be treated, and the how you're going to treat depends. In acute hepatitis, as we say, the patients present with non-specific symptoms, and most of the times it resolves without treatment. Yeah.
Okay.
Chronic hepatitis B, there are clear guidelines on how to treat, based primarily on whether the patient has chronic liver disease, how severe the liver disease is, whether they're compensated or decompensated. Decompensated will mean that the patient is really permanently presenting with symptoms of liver disease, and based on the viral load, on the viral levels, and based on the markers of the liver function test. So you test the liver functions and you see how it is. You look at the viral load and you also look at the function of the liver, how it's functioning. That is what determines how you're going to treat. Hepatitis C, on the other side, you treat all patients who have infected as long as they have chronic disease and they qualify to be treated. In places where we don't have resources, you want to only treat the ones with severe form of liver disease. But anyone in hepatitis B, as long as they have severe form of the disease, chronic form of the disease, they should be treated. And basically, treatment is use of the various form of treatment. For hepatitis B, you'd be talking about antivirals, and they're easy, cheap drugs. You know, they're more or less the drugs we use for HIV, the lamivudine, the tenofovir, and this can be done at a district hospital. As we're speaking, the Gastro Society of Kenya actually rolled out some guidelines recently about treatment of hepatitis B in the peripheries.
Okay.
So it is treatable. Hepatitis C is more difficult to treat. They need to be referred to specialists, but it is treatable, much more expensive, but yes, it is treatable and it's curable.
Can it be can it be transmitted through sex, hepatitis?
Yes, it can.
Yes, it can.
Actually, the modes of transmission of hepatitis B and hepatitis C are similar to HIV. Just similar to HIV, blood transfusion, sex, and all that. The only other problem is that hepatitis B is 100 times more infectious than HIV. Keeping in mind, like, if you touch blood that, probably had HIV and poured in a place, after around, an hour or so, you cannot get infected. But come to hepatitis B, 14 days later, they're still infectious. So hepatitis B is just more infectious than HIV, but modes of transmission more or less like HIV.
I think to address your question, Sophia, about whether it can be transmitted through sex, yes. Hepatitis B, in areas where it's not very prevalent, the most common mode of transmission is through sex. So you'll see it in an older population from adolescent onwards, and there's a room for intervention there. If your sexual partner is found to be hepatitis B positive, then the partner should be tested. If they're negative, they should be vaccinated to prevent them from getting infected. And they need to use condoms. You need to use condoms, you can vaccinate the partners. Hepatitis C, on the other hand, the predominant form of transmission, I said, is blood. Sexual transmission is not very common, and so it's not very common to transmit through sex, so partners do not necessarily have to use condoms.
Right.
Yes, as long as they're not multiple sexual partners, and they're not it's not men having sex with men, and they're not HIV positive.
Clarify on those last points you just made. Why is that important to keep in mind?
It's important because patients who have men who have sex with men, people who have HIV, and people who are immunocompromised are the ones who are at higher risk of getting hepatitis C transmission. So those are the people you need to prevent transmission of hepatitis hepatitis C sexually.
Okay.
But in people who are in heterosexual sexual relationship, that's a man and a woman, and in a monogamous relationship, hepatitis C transmission is not as common through sex.
We have a question here from Mwangi. He says, I think I've been exposed to the hepatitis B virus. What should I do?
He needs to get tested.
Yeah.
The first thing is to get tested, and so there are basic tests that you can do, and once the doctor does, the first test we do is a hepatitis B surface antigen, and from there then you escalate the test to identify is it an acute infection or is it a chronic infection. If it's an acute infection, most of the times it will resolve. It is a chronic, then they determine does it qualify for treatment or not, or is it just for follow-up.
Okay.
Yeah.
We're talking about acute, that means it's not as serious, and in terms it is. You seem to disagree.
Yes.
Okay, for the cases where it is not, or even for either of,
Yes.
how long then do the symptoms start to show?
Maybe it's actually varied. There's no clear-cut time when the symptoms will start showing. But usually when you talk about acute symptoms, you mean the first 6 weeks. Those are the symptoms you're going to have in the first 6 weeks, which are non-constitutional. But then when you start talking about chronicity, is anything above 6 weeks. But there are no clear-cut lines that my symptoms will start showing from this time.
Yeah, maybe for the public, what we need to clarify, when you talk about acute hepatitis refers to infection from day 0 to 6 months. If your test for hepatitis B or C remain positive, or hepatitis B, sorry, remain positive 6 months after, then that's when we call you chronic hepatitis. I think that's a distinction. And as she said, usually if it's hepatitis B, the incubation period is about 6 weeks to about 3 months.
So Mwangi needs to go to hospital for a checkup.
Exactly.
For sure.
Yeah.
You talked about prevalence, high prevalence here in Kenya, and developing countries. Why is that Kenya we have so many numbers? Do you know, Eric?
The reason being that in developing country, also culture can also be, one of the highways actually to propagate hepatitis. Keeping in mind, like people who do a lot of scarification, if the culture that supports scarification and all that, and the instruments that they use, that one is an avenue for infection. Circumcision, male circumcision, if the instruments that are being used are not sterilized, you're being circumcised at home, and it's multiple people, then again, you'll be infected. And then also for the ones who are infected and they stay in close proximity with their relatives and all that, they are also at risk of getting infected.
Okay. All right. In terms of how many people, because then when you have many people dying and you're talking about it being more of a silent giant, huge giant, killing many people, is there enough support and help coming from the Ministry of Health? Is there enough of education and breaking down the information, especially at the grassroots level?
Basically, that's why we are really supporting this. We are having the World Hepatitis Day coming up on July the 28th, where we are actually going to be preaching about hepatitis, because people have not talked about it. We are hearing more about HIV and less of hepatitis, and yet hepatitis is more giant, like you're putting it. It's more of a killer than HIV. So that is why we have the World Hepatitis Day on July 28th, which we are going to be supporting more of testing, vaccination. We test you if you are negative, we vaccinate, and we are going to tell the public about hepatitis.
There is a lot of support from the government, I must admit, especially with regard to hepatitis B. As you very well know, she talked about the universal vaccination that was introduced in Kenya in 2001. So there is enough vaccination, and there are certain people who are being catch-up populations which are being vaccinated. You've heard about a lot of IV drug users being given needles and being tested. I think the government is really supporting in that sense. Yeah, I think the message has been going out loud, but we'd want more effort to be put, especially in the chronic hepatitis, management of a chronic hepatitis.
Kenya has been said to consume 3/4 of the alcohol in East Africa, so there's a lot of that happening. And with the liver being affected, then what, as we bring this to a close, do you say to the Kenyan population, Eric?
Yeah, it's one of the causes, main causes actually of hepatitis, and especially people who are really hooked up on alcohol and the hard, tough drinks.
Yeah, we've seen the deaths as well in the recent past.
Exactly, and even if you look at the deaths, the first organ to be affected is normally the liver. Yeah, if you take those hard drinks and all that. So the first organ to be affected is the liver, and that is why incidences of hepatitis then, will escalate especially, hepatitis due to alcohol. So I think advocacy, there's a lot of advocacy, NACADA doing a lot of advocacy and all that. So I think it will work.
It will
eventually,
work. Yeah. Do people understand that liver, what role it plays in the body and why it's important to take care of it?
I don't think people do.
Yeah?
I don't think people do.
Help us understand.
Okay. I think the liver is actually the largest gland in the body. It's the second largest organ after the skin.
Yes.
Weighing about 1.2 to 1.5 kgs. It's about 2% of your body weight. Has very important functions. The primary thing is metabolism. It metabolizes our nutrients into ways that they can be absorbed. It detoxifies, produces proteins both for maintaining the body, building the body, and also for immune purposes. So once the liver fails, then the whole body entirely fails. Unfortunately, you only present much later on. Yeah, so most people will not realize. And just to emphasize, like alcohol, you'll drink alcohol for very long. Maybe out of 100, only 5% will end up having chronic liver disease. But the 5% who get it have such a huge burden to the health system. It's such a burden to the health system. So most people will drink and say, I have never gotten affected, so why should I care?
Okay.
But the 5% who get, it's terrible, and it's very expensive to treat. As we speak, we don't have liver transplant in Kenya. So once you get, if you get end-stage liver disease in Kenya, it's just supportive treatment, and yeah.
And that's it.
And that's it.
Okay, finally, your closing remarks on this subject.
My closing remarks would be that on July the 28th, you're having the World Hepatitis Day. So please be on the lookout to go for testing. If you're tested negative, go for vaccination, and let's take care of ourselves.
All right, finally.
I think for me, it's encouraging people to get tested and to get vaccinated, especially people at risk. This would be healthcare workers, people working in the labs and hospitals, and people on chronic, like hemodialysis, just going out there and spending the little money to get vaccinated.
Okay.
Makes a difference.
Finally.
Yes, finally, I think support from partners, like what we are doing at the Regional Society for Blood Transfusion. We are even supporting and advocating among us, even rugby players. It's a highly contact game. So we've been having workshops within when they're having their, rugby sevens, just to make sure that they know, they are informed about hepatitis, so that they can also be protected. And also other partners are in play. KEMRI really comes in strongly in supporting in testing. We have also other organizations like a Blood Link Foundation also who deal with blood. So all this coming together, I think we are really going to support the issue in preventing hepatitis spread.
All right. Thank you for joining us this morning. Hepatitis discussion, and of course, more information will be coming through on the day, 28th of July. You said, which is
actually it's a whole week of activity.
It's a whole week.
The whole week of activity will be pitched in several areas in Nairobi.
All right.
And we encourage people to come and get tested.
Okay.
Yes.
Do that, people. And thank you all for watching Morning Express today. We have John K. Judge saying, I missed a bit of the way it is this morning due to the early start. Sorry about that, but next week, back on normal time. Just needed to accommodate one of our guests this morning, but at least you did catch some of it, and of course we'll be posting it on our online platforms, and you can watch the entire show there this morning. Somebody's actually talking about most doctors don't actually do the real diagnosis. They just ask questions and subscribe medication. I don't know which one of you would want to respond to that. Is that the case on the ground before we bring this to a close?
It could be true. I think most of the peripheral hospitals might not have access to proper testing for hepatitis B. But as we speak now with the county, most of the county hospitals are capable of testing hepatitis. So moving forward, that should not be a problem.
All right. Just Njuguna, back to your feedback, saying that you won the book. Yes, we did communicate to you. You'll be getting that email today. And Stephen as well is the other winner. A lot of you have been asking about that. So we did ask for your email addresses. We'll be emailing you the details of how you can come and collect your signed copy right here at the Standard Group. But more of your feedback on what the show was like, especially on the way it is earlier. Paul Otieno, with due respect, I think the lawyer referring to Ambrose Weda needs to be informed before going about his opinion this morning. Robert Funani, why is Omar Hassan talking with a lot of vengeance? Let's sober up, you say. We have Otieno saying, okay, I shall not read that one. It does not say very nice things about some people. These guys are putting the issues into perspective. Brayo Harper, That's what your tweet says this morning. ODM Reloaded, Victor Onyango, you saying, as some of the comments that Hassan Omar was saying, Salad Malicha, Jubilee has failed miserably, is simply what you say. Stephen Zhao, on the other hand, says, you have to admit our president is not weak. He's a rational man who gives peace a chance. Those were your thoughts this morning. Again, Saladus, you say Olalenku needs to wake up, and don't we all agree on that? The devil lies in the details. So sad to hear this learned friend speak as he does to one of us. Since they're both learned friends, I'm not sure which one you're referring to. Then there is a thin line between hate speech and freedom of speech. Paul tweeted, and many more of your sentiments this morning, and we thank you very much for watching the show and for tweeting and texting as well. We'll see you again tomorrow. We have a great show for you as always. Have a lovely Monday and take care.